So my name is Jessica. I'm, again, one of the physical therapists. I mostly do pediatrics. I sometimes attend the PDCF clinic and do some adults depending on where they need me to go. So I'm going to talk about airway clearance and CF. Most of this will probably be pretty familiar to everybody, but we'll just kind of review it. So they've been using airway clearance from about the 1950s. So you can see on the chart that hopefully we've played a good role in increasing the life expectancy, kind of a nice jump from the 1950s to the 1960s, and then obviously continuing to jump even more as we get through the late 90s and the 2000s. So airway clearance works by altering the airflow and moving the mucus. And if you are good about doing airway clearance frequently, you're going to get less lung infections, hopefully, and get better lung function in general. So usually we talk about people doing airway clearance twice a day when they're feeling pretty good as a maintenance sort of thing. And then when they're not feeling so great, they're exacerbated, they're in the hospital, they're coming down with a cough, anything like that, you really want to be upping it up to 3 times a day. So the basic ideas are airway clearance. You have conventional chest PT, high-frequency vest. You have an oscillating positive expiratory pressure, which is your acapella or your flutter. And the last 2 are actually breathing exercises that help to move the mucus. So active cycle breathing and autogenic drainage. So we're just going to go through those. So probably everybody's pretty familiar with chest PT. They sometimes call it clapping. Probably for those people that have ever done it to their infants or had it done to them, that's what you usually are doing for the infants. That's pretty much your only mode of airway clearance when they're under a year old. So sometimes you use palm cups, which are little plastic, different variety of sizes, depending on what kids will tolerate. But a lot of infants will actually tolerate just a regular hand. They usually have no trouble with that. Some people that might be older CF patients, we originally were doing a lot of tipping. We've kind of gone away from the tipping when the head's down, the feet are up, because we found that it causes problems with reflux, which a lot of CF patients already have some gastric reflux issues already, so we don't really want to make things any worse, obviously. And there's a lot of people, especially some of the adults, that really like to have chest PT when they come into the hospital. They find it a little more effective for a clean-out regimen. The problem being with chest PT is obviously you need somebody to do it for you. It's not something you can do on your own. And it can be hard to get kids to sit for 30 minutes to 60 minutes, especially when they're really little. They're squirming around, they're trying to jump off the bed on you, that sort of thing. But it usually is pretty effective. And then this is the oscillating vest, which probably all you guys, or most people, are probably familiar with. I think there's a Hill-Rom and there's a Smart Vest. We tend to see a little bit more of the Hill-Roms. Again, you're looking for a 20 to 30 minute session twice a day. We usually go through the settings with you as far as every once in a while reviewing the settings, making sure you're at the right setting. You want something that's you're feeling like you can tolerate, but that's being effective, that's helping you to produce what you need to be. The advantages are that you can be done by yourself. You just put it on. You can pretty much watch TV. Sometimes that's really good for little kids. Parents will kind of say, you know, if you put your vest on, we'll watch this sort of particular TV show, and that can get them still for about a half an hour, which is about what you need for the most part. And then sometimes you can use your nebulizer if you want to at the same time, so you're kind of be able to make things more succinct if you're really short for time or something like that. And the thing I wanted to mention, we have gone away from letting people use our vests and our machines, so now we're for infection control purposes. So at the hospital, if you're going to bring in anything, you need to bring in your jacket and your machine. If you just bring in something else, we're going to be giving you a wrap vest, which is disposable, and then we attach it to our machine. It just found that it's better for infection control, so we're not passing on vests from one patient to another patient to another patient. We clean them, but you know, you can never be so sure of how well you're cleaning them. So this is the PEP, so acapella or flutter. This picture right here is the acapella choice, which is I think what we've been using more so than the flutter. The flutter is like that rigid piece of plastic that's kind of set at a 90-degree angle. This acapella choice itself opens up, which is really nice so people can clean it out. And you can also attach it to a nebulizer if you wanted to do it at the same time. So basically it works through producing oscillation. So when you use it, you'll breathe through it, but you sometimes feel some vibration internally, and it helps to move things through. Again, you can do it for you want to do at least 10 minutes, 20 is better. And the good thing about this is you can take it with you. So sometimes people, if they're going camping for the weekend, or they're in the car and they haven't had time to do any airway clearance, they can do it then. But the big problem is people are not always good about using it as they should. They kind of think, oh, I did 5 breaths, it's done. When in reality, you need to be doing it again for like 10 to 20 minutes. So sometimes with kids, you need to really be sure that they're using it for the appropriate amount of time and using it appropriately. It usually is a version of doing 5 regular breaths, 5 really extended breaths, and then some coughing. So sometimes kids need a little help with following through on those. These last 2 things might be a little less familiar. It's called active cycle breathing. Again, it's kind of a breathing exercise. So you have breathing control, which is like a normal everyday breath. You have thoracic expansion, which is your deeper breaths, which you're going to hold for a little bit at the very end. And then a forced expiratory technique, which is kind of your huff, which I guess people are probably familiar. It's kind of you're really using your abs, opening up, and you're that's your huff, which probably most of you guys are pretty familiar with, but that helps to produce the mucus and get it out. So it can be a little difficult to learn. It's usually okay for kids that are in elementary school, older elementary school and over, but for little kids to quite get the whole breathing technique, where they're supposed to be breathing, how much they're supposed to be breathing, is a little tricky. But it's great in the fact that you don't need any equipment. There was one girl, she was saying on the internet that she does it when she's in school. You know, and nobody needs to know you're doing it. You don't have to feel like someone's watching you and what are they doing. You can pretty much do it whenever, however, and hopefully get some good results. And this is sort of similar. This is autogenic drainage, which is called, they also refer to it as self-drainage. The big thing with this is supposedly they say you have to be able to feel the mucus movement. Supposedly people that have issues with mucus movement, like CF and such, can feel this, but it's a technique that is moving the mucus from the bases and the smaller parts to the more main bronchus and such, that you can expectorate it out, cough it out. So you have low lung volume breathing, so it's your kind of your shallow, normal breathing. Then you go to a little lower, and then you're deep breathing, and you're holding it at the very end of each piece, and then you're doing a huff. So you kind of go, again, 10 to 20 minutes, more like 20 minutes, and you're going through a cycle, hopefully producing some mucus. But again, it can be a little difficult to learn, and there's not a whole lot of therapists that are really that familiar with it in order to educate you on it. So basically the take-home message is you basically, as an exercise, you got to do what works for you, what fits into your lifestyle, what you find effective, and that sort of thing. And that you're using the proper techniques, that you're adhering to as long as you're supposed to be doing it. You're not cutting it short. You can combine therapies if that's effective for you. And sometimes little is better than nothing. If you can get your child to wear the vest for 5 minutes, it's better than them not wearing it at all. You know, so it's kind of take what you can. If you have 15 minutes to put your vest on for 15 minutes, versus saying, oh, I don't have the amount of time to do it for 30, I'm not going to bother. And then the more techniques that you know, the better it's going to be as far as fitting into your life schedule. So you know, if you want to go camping, you don't have to drag your vest with you if you're effective with using your acapella. So this way it just makes it a little easier to fit it in and then to actually go through with what you're supposed to be doing for airway clearance.